It gives me great pleasure. I'm not going to introduce this panel. I'll let the moderator do that. But I do want to simply introduce the World Health Organization, who is supposed to be Dr. Tedros, and Catherine will explain why Dr. Tedros is not here, and you will understand why. But the WHO has been a leader in this space since 2012. It's the first global organization that basically recognized dementia as a global health priority, and it has been a leader through a variety of mechanisms over the last 13 years. And I just want to introduce Catherine Boehme, the Assistant Director General of the WHO. Thank you for being here, Catherine.
Thank you. Well, thank you, George. Panelists. You know, it's so good to be here with all of you, lots of friends, partners of WHO. Thank you to the Davos Alzheimer Collaborative for hosting this important discussion. As George says, Dr. Tedros really wanted to be here with us today, but is working with the government of Tanzania to contain the Marburg outbreak and couldn't leave in time to come back here. However, he did tell me that I must deliver his speech as written, and so bear with me if at times I don't speak from my own heart, but from his heart, which actually is even better. Yeah. You know, as you can imagine, we at WHO haven't had an easy night and not a lot of night sleep, you know, but it's with this in mind even more important to be here with so many partners on this important topic. You know, many of us, if not all of us, have one of our loved ones who has dementia, who has, you know, Alzheimer, or will have in the future. You've heard a lot here in Davos about our aging world, about the demographic trends we're all facing and faced with. And, you know, with this in mind, the urgent need of building the services and systems to prevent, delay, and care for the effects of dementia, which we really at WHO consider essential. Globally, over 3 billion people suffer from a neurological disease, including dementia, but also stroke, epilepsy, and many other diseases. Yet, from a global health perspective, and here I'm wearing also my governance hat, member states have often not made this a priority. And you know, what we see around the world is that the brain and diseases that affect the brain still often get neglected. Our WHO Global Action Plan on Dementia ends next year. But frankly, the world has not met a single of its indicators. The national policy planning that was planned for the risk reduction, care and service build-up, and also on the R&D front, we've not yet met the targets. Yet, you know, I think all of us here in the room are extremely encouraged by the advances and breakthroughs that we've seen in recent years on the R&D front. There's still no cure for dementia or Alzheimer, but disease-modifying therapies that I know some of you work on show promising results. Diagnostic biomarkers will hopefully support clinical decision-making. So let me take this opportunity to urge all of you here in the room working on R&D to please help close existing knowledge gaps and help us strive for safer and more effective treatments. You know, the other important area that I want to touch upon here is the importance of a life course approach to dementia. Almost half of dementia cases are attributable to known modifiable risk factors, many of which are shared with other non-communicable diseases and conditions, you know, stroke, cardiovascular, diabetes, and cancer. Throughout life, our brain is influenced by a complex interplay of genetic, environmental, and lifestyle factors, from conception and early childhood to adolescence, to adulthood and midlife, to then old age. The foundations of cognitive and emotional development are laid in utero and early in life. And that's where it starts. That's where it's hugely important to promote maternal health, good nutrition, access to quality health care, and early education, and to foster nurturing care along with stimulating environments. During adolescence, it's as important. The brain undergoes rapid development and changes, making it a very critical period for lifelong brain health. The education sector and social media have a huge role to play, especially in this period. And environmental risks brought also by climate change and air pollution pose great risks to the brain in this phase. In midlife, brain can be protected through promoting healthy workplaces, including access to good mental health services, encouraging lifelong learning, and supporting healthy lifestyle choices. Physical activity, remaining fit, helps a lot with brain health. And finally, in older age, the focus shifts and has to shift to preventing or delaying functional decline, and preventing, more rapid decline. Key factors at that point also include managing conditions such as hypertension, diabetes, maintaining physical health, and mental activity, and maintaining, importantly, also social interaction. By promoting brain health at every stage of life, we can significantly reduce the burden of these diseases and improve mental and physical health, and importantly, also the quality of life. So what we see is, when we discuss with our member states, that this is climbing up very rapidly in order of priority. Investing in our brain capital matters, and addressing brain health determinants, such as education, healthcare, climate, and healthy environments, will be fundamental for meeting modern societal challenges. To achieve these goals, we need partnership, and we need partnership across corporations, the civic sector, scientists, academia, and patient advocates. And while the health sector has a crucial role to play, it goes far beyond any single sector. I've mentioned already a couple of other players that we need to bring in much more. We need comprehensive policies and investments that promote brain resilience, skills, and health at every stage of life. So let me close by outlining 3 priorities that we see at the World Health Organization. First, whether you are a policymaker, an industry leader, a healthcare provider, or an innovator, you have an important role to promoting brain health. Second, educate your communities and help us to highlight the importance of brain health and the steps one can take at every age to protect it. Third, collaborate and build networks and create these supportive networks that foster lifelong learning and social connection. Because it's with all these 3 things that together we can make a difference. So let me close that, by saying that by prioritizing brain health for ourselves, for our families, and our communities across the life course, we can build a healthier, more resilient society for generations to come. I thank you. So it's now my honor and pleasure to hand over to our moderator, Shameek, Dr. Shameek Bose, Global Lead for Responsible Business from Fleishman Hillard.
Thank you so much. Welcome, everyone. Day 2 of Davos. How are you all feeling? Well, I have to say this is my 10th year in Davos, and this is the most important panel I will ever be able to moderate. So I'm so excited that I got this opportunity to do so. So today we're going to be talking about a life course approach to brain health for the future. And before I introduce my esteemed panelists, we want to accomplish 3 things on this panel today. What are the gaps in the modern healthcare system? We're going to examine some new research that's coming out to identify those gaps and help find some solutions for it. And finally, we're going to explore how multi-sector partnership between employers, customers, governments, and investors can help fill those gaps. So first, without any further ado, to my right, Jon Clifton, CEO of Gallup. Welcome. Sandy Torchia, Vice Chair of Talent and Culture at KPMG. Welcome. Shelley Lyford, CEO, Chair, and Trustee of the Gary and Mary West Foundation, CEO and Chair of the West Health. Thank you so much for being here. And finally, Congressman Patrick Kennedy, who's the co-founder of the Kennedy Forum. Thank you so much. So to kick us off, would love to throw this out to the panel. Let's go really high level first. Why is brain health so important at every stage of life? I think that'll really ground us in this conversation. Who wants to go first?
Well, we all have family members who have brain health issues, or we have brain health issues. So, as Bill Clinton said when he ran for president, it's the economy stupid, but in this case, it's the brain stupid, because the brain mediates everything else. And it has been carved out of healthcare, it's been carved out of the medical system, and it's been carved out of any discussion in society about its centrality of importance to everything that's important to us. And it's exciting here at Davos because the business community is now taking up the cause of advocating for better public policy, because now they're monetizing all of the value that can be gained from better interventions in brain health. If the business community carries the case, maybe we can carry the day, because those of us in the consumer advocacy world are pretty much done with our ability to move the needle anymore. We need everybody to be part of the advocacy community, not those with diagnoses or family members of diagnoses, because unfortunately this issue has been relegated to those people, as opposed to it being, to your question, about all of us.
Thank you.
So I totally agree, of course, Patrick. And I was just putting it in a slightly different way, framing it a little different. Of course, it impacts all of us. Every single person in this room has been impacted. In addition to that, the cost is something that we're going to have to think very, very seriously about. In 2050, it's estimated that Alzheimer's and dementia-related diseases will cost the U.S. healthcare system alone over $1 trillion. So we are already on an unsustainable trajectory with respect to healthcare costs, especially in America. But if we look at this as a worldwide issue, it's a tsunami that is facing us, and we need to get in front of it.
Since we're going down the list here, I'll add to that. When you ask the question about why is brain health so important at every stage of life, at KPMG, we have over 280,000 employees globally. And while we're not able to control what happens outside of work, we certainly have an opportunity and even an obligation to help our 280,000 plus global employees manage their mental well-being. And so thinking about things that we can do inside of the walls at KPMG for each and every one of our individuals. It's so important for them as people. It's also good business sense, because just like you wouldn't want someone that is physically injured showing up to and expect them to do their best work for a client, we also wouldn't expect someone that is having mental well-being challenges at any area on the spectrum to show up and do their best work. So it makes good sense for people, it makes good sense for our business, and we have an opportunity and an obligation for the 280,000 plus employees that we have around the world. That time that you're spending at work, from an age perspective, the length of your life that you're spending at work, as well as the number of hours per day that you're spending at work, it's a great opportunity to do things differently.
Yeah, I think your original question was why brain health and why right now? And at Gallup, one of the things that we've uncovered is what we'll call the other global warming. And it's because of this other global warming that makes this conversation so important right now. So what is the other global warming? About 20 years ago, we started to ask people in about 140 countries. So in 100 countries, we asked people, doing face-to-face interviewing. The other ones, we called them in their homes, and we asked them if they're experiencing debilitating stress. We asked them if they're experiencing debilitating anxiety. We asked them about their anger. We asked them about their sadness. In fact, during 2020, we called a woman in Vietnam and we asked her about her happiness. And the phone almost, it sounded like it went dead. And the woman said to her, "Sis, are you still there?" She paused and she started to cry and she said, "No one's ever asked me anything like that before." But think about that. And so now the next question though is if we've been asking these questions in 140 countries systematically about people's pain, anger, stress, etc., what is it today? We have seen a 10-point rise almost systematically across the entire world in these debilitating negative emotions. If that was a concomitant rise in unemployment, it would be headlines everywhere. But yet when it's about our mental health, it goes almost totally unnoticed. And that's why it's so critical we're having this discussion today.
Thank you so much for bringing in the human element of that discussion. And I want to actually double click on that and throw it to you, Congressman, to really help us talk. If a person is actually given the support, how does that help in their resiliency and to cope through mental health illnesses and suffering versus those who don't have that support?
So I'm championing mental illness care because brain is not reimbursed for treatments like the heart, like any other organ of the body. So that's my focus. But I'm also President Kennedy's nephew, and when I was asked to rededicate the John F. Kennedy Special Warfare Center, where they train Green Berets, the general at the Fort Bragg said to me, "Congressman, I admire your work on mental health." And I'm like, what's this got to do with Green Berets? Like, these are the guys that jump out of airplanes and they land in the water and they go underwater for 5 miles without breathing, and then they hit the beach and they speak 6 languages, and then they take out Osama bin Laden, and they're reading to their kids by bedtime. These people don't need mental health. And he said, "Congressman, in the Green Berets, we look at mental health as a force multiplier." And I had never heard that before because I'm focused on mental illness, not on mental unwellness. But he was saying something that we never hear when we're talking about brain, which is thinking about it as an optimizing opportunity to accelerate and to live out our fullest potential as human beings. Because all of us have a reaction, "Oh, that's scary. We don't know how to treat illnesses of the brain as effectively as other illnesses. We think it's a hard issue to tackle because the brain's hard to understand." And so we fear up, we back off. But if we can think about all the ways that we can accelerate the positive, if we do the right things, then it seems less unmanageable. And people want to have some agency, and giving them the tools to make the right decisions and also to learn how their brains work. We have no literacy. People don't understand. Part of the reason we're in a political climate we're in is because we're cutting off ties to the WHO in the United States because we're reacting. Because we're in a reactive brain. We're a fear-based reactive approach. We're not using our prefrontal cortex, we're using our amygdala. If people understood these issues, they would understand a lot more of how decisions are made in the world and in our own lives and those lives of our family members and relationships. So teaching people about how their brain works as part of health and education will go a long way to help build this as a public health issue. And kids today, given the point you made about them suffering a great deal, really want to know how to get a license for not only driving the car, but how to drive their brain. How do I intercept counterproductive thinking patterns so I don't make self-destructive decisions? This sounds kind of ethereal until if you're someone like me in recovery from addiction, it has been the difference between me being alive today and a present father in the life of my 5 children and my spouse, and being someone who racks up, hundreds of thousands of dollars of medical cost every year because I go to the ER because of contusions, lacerations, and broken bones. That literally was my health care insurance reimbursements because I was untreated addict and alcoholic. Now that I'm not active and I get treatment, which is social, by the way, I've never had to visit the ER in the 14 years that I have stopped using drugs and alcohol. Blue Cross Blue Shield, which is my insurer, ought to pay my group millions of dollars because by going to group therapy, I have saved them a lot of costs in the rest of the medical system. But I love what George is doing to tie the brain together because I'll tell this one last story. President Kennedy started the National Institutes for Children and Human Development because his sister, my other aunt, had an intellectual disability. And they researched developmental disabilities and found people with Down syndrome had much higher dementia rates than the average population. So 60 years ago, the National Institutes of Health were researching dementia when we didn't even really know the lexicon of Alzheimer's. The irony is that institute's named for Eunice Shriver, who started Special Olympics. Eunice lost her husband, my Uncle Sarge, to Alzheimer's, and her 5 children are all at risk for Alzheimer's. How could she have known that by studying children, she'd be getting answers for seniors? And the point is, we're all interconnected because who would have thought by studying kids with Down syndrome, we would have advanced the understanding of those in the aging with dementia. So my point is, it's the brain, it's the brain, it's the brain. We have to understand the brain as a whole as opposed to by diagnoses. And the advocacy community is siloed by diagnoses. And if we're going to make advancements for Parkinson's, Alzheimer's, and eating disorders and addictions, we have to build an infrastructure that will understand how the whole brain works, and from the genome to the proteome to the metabolome to the phenome. And we have the data abilities today with supercomputing to get large data sets from people in Africa and Asia, in the United States and everywhere else in South America, to all be part of replicable science, so that when we can make advances in the United States, those advances automatically translate to people anywhere else in the world, because we all know that these are the interventions, because we're all part of the solution. So we basically need, as George likes to say, a brain trust for the brain.
Yeah.
We need to get the smartest people together to help address this.
Thank you. Thanks for your vulnerability. Really appreciate it. You know, as human beings, as you just well articulated, in order to be resilient, we have to be open, honest, transparent, and destigmatize a lot of the stuff that you're talking about. And most of us also have a job and and there's a lot of conversation about how you show up and how you talk about mental health in the workplace. So I want to go to you, Jon, because Gallup does a tremendous amount of data of employees around productivity, how they're feeling, their resiliency. If you can share some insights from what you're finding from your research.
Well, I think it's a great question because, although we kind of alluded to this, if you want to understand somebody's life, look where they spend the most time. And there was one analysis that said that we spend 110,000 hours of our life at work. We tried to replicate it by asking people how many hours they spend at work, and we found that it was about 83,000 on the lower bound. And so the only thing you do more in life is sleep. And so if your life at work is not going well, it is very hard for the rest of your life to be going well. And by the way, this notion that we can sort of compartmentalize that after 6 o'clock, because our boss can't email us, does not necessarily mean that we aren't carrying the baggage home with us and therefore continuing the debilitating stress that we exhibited or experienced at the workplace. And so one of the things that we want to understand is, how bad is it? And so we study well-being at work. And what we find is that globally, 80% of people are not thriving at work. They're really struggling. In fact, there's another smaller percentage that's even suffering. Now, a lot of people sort of go, well, isn't that just the way it is? No, it's not. In fact, we did another survey where we asked the entire world, how do you feel about work? Do you enjoy it? Well, if work was so awful, 80% of people would not have come back to us and said, I enjoy the work that I do. It's because teachers enjoy teaching. People who provide healthcare enjoy providing healthcare. So something is wrong. And what's wrong is not the work. What's wrong is the workplace. And that's the problem. So we found that there are a number of contributing factors, but if this gets back to brain health, one of the even more concerning pieces is we said, is work something that affects your mental health, and if so, how? 40% of people said it negatively impacts my mental health. And that needs to be addressed, otherwise we won't be able to see at least the flattening of that curve of the global rise of negative emotions.
Thank you. Sandy, I'll go to you next. KPMG, global workforce. Can you talk about some of the intergenerational differences you see in the workforce on mental health?
Yeah, it's super interesting. Similar to what you heard from Gallup, we spend a lot of time surveying our people to understand how they feel about work, how they feel about the workplace, so that we can devise solutions to help them with the things that will not only make their days better, make their experiences better, but also, to your point, carry over into the rest of their lives. And so our continuous listening strategy, we survey our people at least 4 times a year. We do long surveys once a year, shorter pulse surveys, quarterly, to make sure that we're gleaning the information that we need to help our employees with a variety of different things across the spectrum of their KPMG careers. And a couple of the things that we found recently, well, we're able to take this data and we can look at it from a number of different perspectives. We can cut it generationally to see what types of generational differences there are in the workplace responses. We can also look at people that are considered higher on the performance scale or lower on the performance scale. We can look at tenure, we can look at background. So it's a survey that gives us a lot of information about different demographics of our population, again, so that we can devise solutions. 2 of the key questions that we frequently ask, one of them is about engagement. So we're interested in seeing how engaged individuals are in the work that they do. And we've actually seen, since the pandemic, our engagement scores, and I'm going to share with you the U.S. results. Our engagement scores since the pandemic deteriorated. We have been very focused on helping those scores increase, because an engaged workforce is a workforce that helps us produce the types of things that we need for our clients. So engagement was something that was challenging. And the other piece that is a contributor to how engaged folks are is energy. So we ask a question, are you able to maintain the energy that you need to do your job? And the results of this question were very concerning. We've also seen increases in this over the past 2 years, but they're still not where we want them to be. And so when you think about lower engagement than you'd want, when you think about energy levels being lower than you want them to be, that gets back to your experience at work. It could be influenced by so many different things, but mental well-being is something that could impact it or be impacted by it. And so we've done a couple of different things. Well, first, when we look at this generationally, we understand that there are different drivers to high engagement, different drivers to feeling like you have the energy to accomplish what you need to accomplish during your day. And one of the drivers that's very different for younger generations is having flexibility in not only where they work, but how they work. Flexibility in one of our recent surveys was actually more important to our younger generations than compensation was. Compensation was a close second. It's always near the top of the list, but flexibility was really important. And again, I'm not just talking about where you work, but how you work. And so thinking about flexibility being important, looking at engagement levels being down, looking at energy levels being down, one of the things that we started doing was producing something that we call energy reports. So each performance manager is given a report for all of their counselees that gives key indicators of why they might have lower energy levels, why they might be responding to our surveys in this way. And one of the things that pieces of data that we collect to give to them, one of them is, have they taken days off? Right? So we look at people that haven't taken enough days off. We look at individuals who have utilization, so the number of hours that you're charging to clients, is that higher than it should be? We also look at, we did this during the pandemic, we continue to do it now, how much time you're spending on video calls. All of those things might not lead to a problem, but they might. So it's given to performance managers so they can have a discussion with individuals. And then we train our performance managers on how to have these discussions. And there's nuances around how you might talk to someone who's earlier in their career to how you might talk to someone who's more advanced in their career. And then we give them tools and resources to help them address the challenges that they might see. So having this opportunity to ask our employees how they're feeling about the things that they're doing, digging into that and understanding the root causes, and then giving our entire workforce tools to be able to deal with it. And so there's, different generations respond differently to the surveys. Different types of mechanisms work better with different generations. But for younger generations, we see that flexibility is super important. So thinking about how we structure our day has been a big part of that solution.
Yeah, really appreciate that. One of the challenges is the funding gap, right? How do we actually scale a lot of these solutions? And Shelley, would love to get your take on, well, whose responsibility is that anyways? Is it the government's? Is it the private sector's? Is it philanthropic investments? Would love to get your take.
Thank you. I appreciate this question. So I think I'm going to answer it maybe in 3 prongs. So I'm going to go strategy, access, and policy. But as we've heard so far from this panel, it's clear that employers are spending money on wellness programs for their employees who are suffering in some way. And I think like 85% of employers have such programs. But there is a steady increase in mental health illnesses throughout the world, despite us spending money and trying these best efforts, if you will. So obviously, we need to be much more strategic, and we need to do things a little differently. So of course, meeting people where they are is critically important. We can meet people where they are in the workplace, but we can also meet people where they are in a healthcare setting. And this is where I'm going to ask my colleague to tag team this answer with me, because but for him and his incredible advocacy and the work that he did in the US Congress, I would not be able to finish my answer and tell you what we're doing at West Health to increase access to mental health. So I'm going to pass it to you to talk about parity for a minute.
Thank you. So I became the sponsor of legislation that required us prohibited discrimination against mental illness. And my bill said that no matter if it's anxiety, depression, dementia, autism, we had to reimburse for any illness of the brain like any other illness of the body. And that was the House of Representatives. The Senate had a bill that said that we only would stop discriminating against people with schizophrenia, which is, we also need to stop this. But that was the idea. Do we do it for just one illness, or do we do it for all illnesses? And this goes back to the whole point that we're all tied together, because you got to stop discrimination in any of these forms. But we weren't thinking as a community, and we had to advocate together. And the biggest fight we have today, to that point of where's the money, is advocating as a community. So in politics, I go where my votes are. But we don't know where our votes are for mental health. So my wife, who's up there, ran for Congress a few years ago. I could not get a list of all the people in that district who had any affiliation. Either they worked in the field of mental health or addiction, or they were a family member affected by one of those illnesses. And none of them knew what to support, like what's enough money? Where do we want that money to go? If you look at the environment, air, land, water, sea, carbon, they know their agenda. If you work for labor unions, it's overtime pay, retirement benefits, safe working conditions, trade policy. In mental health and addiction, where's our political agenda? Who in the United States Senate or the Congress or anywhere else in the world knows what our agenda is? And by the way, neuroscience isn't on the agenda for any affected group. Maybe George, Alzheimer's, but depression, anxiety, addiction, none of them have neuroscience on their agenda. Because they have services on their agenda. They got to get people help right now. And that's all that consumes. But my point is, how are we going to think strategically about improving the system if we don't know what we want from the system? But to the point about business, I go back to how business can make the big difference. If businesses decide that it saves them money to do the right thing, implement better prevention, that wins the case for us, because then other businesses are going to say, this is a no-brainer, no pun intended. We got to do this because it saves us money. And then guess what? They talk to government, and government's like, well, what about us? We want to save money too. Oh, guess what? We've got the strategy because KPMG and Aon and Mercer and Siegel and all of these, McKinsey, all say, these smarty pants people, you know, the really smart, these people say this is the way you save money, or their turnover, absenteeism, presenteeism, and so. And business leaders are going to be like, just show me the facts, ma'am, just the facts. And the facts are, you do these things, you get these results. And when we do that, then people aren't going to feel so overwhelmed by mental health, because they're going to know there are solutions that work. And that's what we have to reinstill in people, is there are solutions.
Thank you.
So I'll also say, just to complete the thought, it's a privilege to sit where I'm able to sit in the United States to build really strategic partnerships to go after big problems. Because of Patrick's work, we have parity. And with parity, we have a policy tailwind. And with a policy tailwind and some money to catalyze a new model, we're working with Northwestern Medicine to bring the collaborative care model, where we're integrating mental health services into a primary care setting, and we are taking that from 7 clinics to 75 throughout Chicago. At the same time, we're engaging with a group out of Texas who is measuring the effectiveness and the impact that we're having with this model, so we can then replicate it throughout the United States in urban and rural communities alike. Almost every community has a primary care facing clinic in some way. And because of parity, and because of an existing workforce, and because of leveraging technology in smart and effective ways, we're able to see more patients, and we're able to meet patients where they are. All ages. If they're not in the workplace, if they're in school, or if they're retired, they're all able to go to a primary clinic. And we're really excited about launching this. We launched it 2 months ago, so I'm hopeful that when we come back to Davos next year, we'll have a host of great results to share with you. And I can tell you that we're in 10 major communities across the United States, rather than just 75 clinics in Chicago.
Amazing. That's really great. I'm going to come to audience questions in just 1 minute. And so think about what you would like to ask our guests. But before I do, I want to turn to Jon for a quick second and talk to us a little bit about what steps employers can take to ensure that they have really engaged employees based on the data that you're seeing.
I think there are 3 things that need to be focused on, not including what they're already doing. Because again, I think there are a lot of employers that are focused right now on EAPs and trying to figure out how can we best support our employees. But I think one of the great failures is we're not addressing the actual source of the debilitating stress, or the source of the burnout. Interestingly enough, if you look to see one of the single biggest causes of burnout, we ask people all over the world a group of questions. One of the top 3 biggest causes, they don't know what they're supposed to do at work. Think about that. So we're primarily concerned, as we should be, about hours worked or the pressure to get something done on time. But one of the most fundamental things is just, do people know what they're supposed to do? So when we pose that question to the world, we find that 50% of the entire world says, I'm not sure I fully know what I'm supposed to be doing at work. By the way, aside from mental health issues, imagine what we could do for human productivity if we all just had that one sorted out. The second thing is, this is one of the questions that we ask that most correlates with debilitating stress. And if you just do a thought exercise, it makes sense, but it's whether or not people agree with the following statement. Do you have what you need to do your job effectively? Do you have the resources and materials you need to do that job? The reason I say that it's an easy thought exercise, but we saw there was a person at work, and they basically needed an Arabic keyboard in order to finish their job. If you go to HR or wherever it is and say, I don't need an English keyboard, I also need an Arabic one so I can speed this up, otherwise we have to subcontract. And as soon as that moment there's a rule that goes, no, we don't have budget for that. As soon as she sees that through the EAP program that they're going to invest in more yoga mats, the moment that the yoga mats hit the floor, you have left her off 10 times worse than if you never would have got those yoga. Why? Because the reason she joined the organization in the first place is because she knows she's good at something and she wants to help the organization push the mission forward. And interestingly enough, it's the organization that's holding her back, not more investments in EAP programs. And again, to be very clear, what I said is those aren't wrong to invest in EAP. They are exactly right, but we must fix the organization at the same time that we're helping address these employee assistant programs. Last thing I'd say is that we did a fascinating analysis, because what's the third thing? And we see that it's a crash that's happening among young people in the United States, but it's a decline in mission and purpose. People don't feel like they have that attachment on being a part of something bigger. It could be from a lack of executive communication. It could be something that's happening within our schools and universities, but it is a massive problem. And one of the most fascinating analyses that I've seen come out of our organization the past couple of years is one of our colleagues got, in a data world, almost as near close to causality as you can. But what he wanted to see is, of all the things that we measure, what comes close to predicting in congressional districts, just again a very small analysis unit, deaths of despair, the concept that Ann Case and Angus Deaton published in their book. And what he found is that of our 5 elements of well-being, things like community well-being, physical, social, or financial well-being, the number 1 was purpose and career well-being. That was the one that most tied to deaths of despair, and it's a fascinating analysis. So when you think about what is it that employers need to do, first, structurally, they must fix things at an organizational level to decrease the amount of debilitating stress and anxiety that exists within employees. It must start at the basics with knowing what's expected of them, getting them the things they need to do their job, and tying it to a purpose. And the last thing all those 3 things have in common is the manager. Start there, and you will take organizations in a much better place.
Sandy, how is your EAP program at KPMG?
You know, it's good, but I totally agree with the comments that you just heard, that it is so much more than that. And we have a 3-prong approach where we want to make sure we have the right benefits to meet you where you are with what you need right now, and the right benefits to help you grow into what you might need tomorrow. So our EAP, we spend a lot of time focusing on that because it is one of the 3 priorities that we have when we think about mental well-being. But the other 2 priorities are right on line with what you said. One of them is rethinking how we work, right? So looking at the way that we conduct an audit, or the way that we execute a consulting engagement, the way that you interact with your manager, how you find purpose in the work that you're doing. Even thinking about, I like to say, you know, we do really hard work at KPMG, but it doesn't need to be hard to work here. And so you think about the opportunity ahead of us with the adoption of Gen AI, that certainly can create some stress in the system, but it also creates an opportunity to work differently. So deconstructing work, looking at how we work, some of those things that might be the sacred cows of, we've always done that way. Do we really need to continue doing it that way? So our second focus is looking at how we work and thinking about how to work differently. We had a global pandemic that taught us that we didn't need to be at a client site or in an office every single day. So can we force something upon ourselves to say, we don't need to do that thing that way anymore. There's a different way of doing it that'll take some of the stress out of the system and help us work differently. And then the third thing that we're focused on is really taking some of the stigma out of mental well-being. So having it be part of everyday conversations. You know, if I walked into an office and I had a cast on my arm, someone would ask me, what did I do? Did I fall? Did I break my arm? What happened? But if I walk into a conference room and I have a frown on my face and a tear in my eye, chances are people aren't going to ask me. And so how do we take the stigma out of having the right type of conversations? That's a silly example, but it goes to show that we've got work to do relative to taking the stigma out of talking about mental well-being. And talking's important so that we can help direct people to the resources, EAP types of work, finding purpose in their work, et cetera, that are really important. So it's our three-pronged approach that we have, and we have historically been very focused on making sure that we have the right benefits, and it's an ecosystem of things that we need. But that's not solving the challenge. It's really looking at how we work, and it's also looking at making sure that we can have the right conversations.
Awesome. Well, let's go to some audience questions. Oh my God, we have some mic runners. If we can get this gentleman a mic right in the front row, and if I can get a time check, that'll be great. Thank you. Go ahead.
Thank you. Yeah, 20 minutes for me. Yeah, I just want to raise a point about something that's often missing in discussions about brain health. Brain health focuses a lot on prevention, the early stages of cognitive impairment. But there's a whole group of people out there who have dementia, who have advanced dementia, severe impairment, and we can do a lot at that stage. But that group tends to get ignored. It gets ignored in terms of treatment. It gets ignored in terms of management. Gets ignored in terms of management, and there's a lot that can be done. There's a lot that can be done to improve the lives of people with advanced dementia, and also it has economic implications. We developed a program, for example, at Baycrest in Toronto, Canada, where I work, where we have patients with agitation, aggression, very severe, very distressing to the patients, very distressing to the caregivers. These are patients that go to emergency departments, they get admitted to hospitals. We developed a virtual hospital, first virtual hospital in the world for these kinds of patients. And what that does, we treat the patients in their own home, where they are, or in long-term care, avoids admissions to emergency departments and acute care, and it reduces the costs tremendously. So what I'm really saying is there are many things that we can do for the advanced group, and brain health should include that, the whole spectrum. And I don't hear a lot of talk about that. I just hear a lot of talk about the early part, which is very important, no question about it. But we shouldn't ignore the patients who are more advanced.
Thank you for that. Any reactions from the panel, or should we get another question in?
Absolutely agree.
Yeah. Go ahead, sir.
Are there any neuroscientists in this audience? Great. I'm one of them, and I'm bringing in a vision where we will totally eliminate all brain disorders. Can you imagine that world? I can, and I'm going to tell you something you don't know. The three pillars of health, all brain health, are genetics. They just cock the trigger. What pulls the trigger is the environment and nutrition. So we can now detect Alzheimer's pretty much 50 years before it begins. Even better, we're not 23andMe that tell you that's what you're going to get. By intervening early with companion interventions, we are turning the entire table around. You will maybe, the next generation won't even need drugs. We do have drugs, but I believe that if you understood what was really driving all mental illness, not just Alzheimer's, an entirely new vision can be put together. Love to talk to you.
Thank you, sir.
Later.
Go ahead, sir.
Thank you very much. Zulmar Ali, I'm the founding director of the Brain and Mind Institute at the Alcan University in Kenya. It's a very interesting discussion that we're having, but when you talk about the life course approach, it's very important to keep in mind the early childhood that we haven't spoken about. We're talking about corporate approaches to mental well-being. But really, there is not a dichotomy between the out there and at workplace. It is same ecosystem. And we have lots of evidence indicating that the early childhood, particularly childhood trauma, has very pervasive effects on our performance at work. And we need to figure out ways of not only identifying early what's going awry and how to kind of fix it before it becomes a problem at work, because it will become a problem at work. And the second thing that was just raised is equally important, and that is prevention. Dementia, for example, 50 to 60% of dementia can be prevented. So if I tell you that I have a pill that's going to be 50% effective in eliminating dementia, that would be a blockbuster. But we have the solution now, here and now. We're not cashing in on some of the evidence that we have. So we need to build resilience and not only depend on the treatment top down. Thank you.
Thank you, sir. This is the magic of Davos. Everyone's a neuroscientist. I love it. Go ahead, sir.
Yes, hello. So my name is Faisal Sharif. I'm a neuroscientist at the University of Oxford working at the intersection between neuroscience, mental health, and neurotechnology. I'm also an Afghan refugee who grew up in Germany. And when you talk about mental health needs, my needs are not the same as everyone else's needs. There are unique needs to specific groups. And we know from tons of research, from decades of research, that people of color, migrants, refugees have unique healthcare needs and mental health needs due to their unique lived experiences of racism, of understanding their own identity, mingling and understanding sort of the nuances of community and the role of family. And these challenges and these microaggressions that result as a consequence of that have an impact on your so-called allostatic load. And this stress accumulates over your entire lifetime. And we know that this stress can translate not only to mental illness, but also to illness that leads to, for example, cardiovascular disease, cancer, and increased risk for diabetes. So we know that intercultural well-being, intercultural mental health is very important, but we're not really addressing it. So what are you doing to make sure that these needs are also seen and that we see the variety of needs of lived experiences in that way?
Thank you. Does the panel want to take that last question?
So policymakers have no guidebook on all the policies that they could pursue that would address all of the different populations and all the different risk factors. They have no idea what primary, secondary, and tertiary, prevention is. They have no idea. And so we as a community need to put that together. Why? Because the staff of those members of the housing committee, I guarantee 80% of my colleagues on the housing committee do not understand the role of housing in the mental health crisis. And I could go on down every single committee. The Defense Department can't recruit enough people to serve in our national defense because they can't pass drug tests. And you could go right through. Highest suicide rate amongst farmers in rural America. But is it in the Department of Agriculture? They don't have a clue. What does that mean? So there's all these ways to slice this, but we need to make it easy for policymakers to know, hey, here comes a bill on this. Let's stick this language in that bill and make it a little bit better on this front. Because right now, we can't enumerate, even with all the neuroscience, all the different things that we can do, in one setting. But all of us at time can put it down in paper and curate it, and people could then know and have the answers. None of us have to do it all. We just have to do our part, wherever we are, whether it's the social stuff, whether it's the medical stuff, the spiritual aspect. None of the churches, my pastor, anybody, knows how to talk about mental health. And as in a congregation that I belong to, everyone comes to me because I'm the only one they know to try to get their loved one treatment, right? There's a problem out there in terms of just on so many levels. But I think if we map it out, we don't have to know everything. We just have to know there's plan A. and some smart group has to put it together. And I think it will inform businesses. What can businesses do? Here are the things. We don't have to reinvent the wheel. What can countries do? What can health systems do? What can each of us in our own lives do?
Thank you. We'll take 2 more questions from the panel.
One quick thing
Go ahead.
quick thing to add to that, and I think what I'm getting ready to say is obvious, but it just takes an ecosystem, right? And we've had a great partnership at KPMG with the Kennedy Forum because we realize we're not experts on mental health, but we have an opportunity to be able to help our 280,000 plus employees. And so having partnerships with organizations where we bring you expertise around data insights, you help us understand how we can interpret those insights from that data to do things differently with our population, and it helps more broadly as well.
So the KPMG did a heat map of available services for mental health. Guess where the biggest problems are? In red state America. And I am going to take that in an administration and a Congress that is not of my party, and I'm going to say, do you like being in an area that's being discriminated against? The blue states have got a lot better than you. Do you want to change that? I mean, you've got to take the data to help policymakers understand they want to make a difference, but they don't know the direction they need to take.
Go ahead, sir.
Congressman, you and I have worked on many policies together. I was advisor to Obama for Brain Initiative, and it's an honor to see you here. I think one of the problems in mental health is that we don't have brain screening. So one of the policies that we are pushing now at the World Brain Mapping Foundation to put this in the healthcare policy, because as you go for your healthcare checkup, you have breast screening, you have prostate screening, you don't have brain screening. So I think those guidelines has to go into healthcare policy in terms of the engaging business groups. What we have done, we have created a fund, and we are starting to build a biotech park for brain to fast-track therapeutics, and even some of the investors coming in and take the therapeutics to the market. So creating that market angle is very...
You're saying we need a checkup from the neck up. But so we really need to identify, to your point about risk factors, ACE scores. We know adverse childhood experiences have this correlation to these outcomes. If you have 3 or more, you're this much more likely. If you come from a family where there's trauma, if you come from a family where there's addiction, where you come from, you can actually stratify. But if you're not screening for it, you don't know. You ask how many in your family have had stroke, who in your family have cancer, to try to give you the medical system an idea. We have none of that. If I had been asked, on my mom's side and my dad's side, a lot of alcoholism, a lot of trauma. But the medical system was writing me prescriptions like they didn't even know that I was predisposed to addiction. And then, of course, there's no chronic care for mental health. There's chronic care for all these other illnesses. But that just said, I know you have a question.
Yeah. One final question and then closing remarks. Go ahead.
Thank you. I'm Alfred Jamshi, founder and CEO of Brain Research Africa Initiative. We just did the Yaoundé Declaration on Brain Economy, Brain Health, and Brain Capital, which we presented at the United Nations Science Summit. And we managed to get 31 members, sitting government members, to adhere to this, and they're going to be co-authors on the paper that is coming out in neuroscience. Where we didn't have a lot of success is with your colleagues, the parliamentarians. And I'm glad to hear your story. My question is, how can we work together to get your colleagues on the African continent to buy in, because the executive is beginning to buy in, at least in Cameroon, the President of the Republic and 31 sitting ministers have bought into the brain health agenda and are willing to push that into their different sectors?
Well, I think parliamentarians talking to other parliamentarians to tell them how they did certain things in other countries could be very instructive, because they're listening to a peer talk about what they did. And then you come with the map, here are the things that you can do. But there's lots of countries that obviously still incarcerate, house people in very awful situations because of their mental illness, and the discrimination's rampant. But we need to have those things. UN has some provisions to try to disseminate amongst, parliamentarians in each country their best practices. That's the great role of what the UN is doing and the World Health Organization. So,
So we have
thank you for what you're doing.
4 minutes left. So I'm going to go to closing remarks. We'll be here afterwards for some additional questions. But I'll start with you, Jon. If you have any final thoughts and reflections on the wide range of things we covered.
Well, thank you to everyone that just shared additional contributing factors to this global crisis of at least a more broader definition of mental health when you look at anger, stress, sadness, pain, and worry. I do think, though, again, if anyone I probably struggle with the most, we do need to make sure that we're doing as good as job as possible as in listening. And I say that because I think the world sometimes is very clear about what the problems are and where we should start. And I say that because, one of the contributing factors, there's even a paper that shows on JSTOR, 2 of them, that shows that there's actually this proof, although I don't know that you needed it because I think you would have gotten there before because it's pretty intuitive. But what researchers found, and FAO has shown this, there is a 10-point rise in global hunger, debilitating hunger. So for 40 years, we were winning the war against hunger. And more recently, we started to lose that battle. And so, again, I want to say thank you because I know we were talking about, global diets. Diet quality is another major issue. The data around diet quality are just fundamentally not there or non-existent on a country-to-country basis. Those are some challenges that we're working on. But again, we've got to get to the root on where we can affect change, where some people are really struggling, and it is causing debilitating negative emotions on a day-to-day basis for them.
Thank you. Sandy, closing thoughts?
I'm going to end with what I started, that as an employer, we have an opportunity and an obligation, right? So with 28,000 people around the world, being able to understand what's important to them and being able to respond to that with things that are going to make their KPMG experience better, allow us to do more insightful things for our clients and help them just have better lifestyles overall. We have an opportunity and an obligation, and we are really excited about being part of the ecosystem and doing what we can for our employees, as well as partnering with other organizations to make a difference in this area overall. So, it's great that our executive team understands that this is an opportunity for us.
Thank you. Shelley?
So from my perspective, facts are friends. And so here are a few facts for us to end with. Every 8 seconds, someone in the United States turns 65. In 2030, in the United States, we will have more people over the age of 60 than under the age of 18. And finally, in the next 15 years, the population globally over the age of 60 is going to double. People are living longer. They are not necessarily living better. And we were talking earlier today about what is the saying, Patrick? It's not the years in your life, but the life in your years. And it is time for us to focus on those life in your years.
Well said. Congressman?
I just echo that and say we're fixated on mortality. But these are illnesses that affect predominantly young people and sidetrack people for their whole lives. And so to that point, we don't value that loss the same way as we value the kind of loss in years. My mother's on hospice today. She suffered her whole life with debilitating depression and alcoholism. I'm not sure when you say, well, she's lived a long life because she's in her 80s, whether I could say she lived a long life, because so many of those years have been really impacted by the disability of these illnesses. And that's the piece that we're missing. And as George knows, these are not just the illnesses of the people who are suffering, but it's everyone who loves those people that are suffering. And we don't often talk about these illnesses in the context of how they impact every family. And that's a part of what we also need to add to the discussion.
Beautiful. On that note, thank you so much.
Thank you so much. I just want to thank this extraordinary opening panel. It was quite diverse in its approach, but clearly made the point explicitly about the life course issue. And I'm also going to say two things about this. This is the first of 6 panels in this Brain House. This is the first. There are 5 more. One starts in about 15 to 20 minutes about part of the solution, investment and innovation. But there are others. We'll talk about Africa later in the week. So I would encourage you to look at the entire agenda of the Brain House. And if you're interested in some of the solutions as well as what you're hearing here, I would encourage you to come back. The other thing, I'm going to take on sort of Patrick's challenge. How do we get all the systems changed that is implied here? This is not just a research problem. It's not just a social problem. It's not just an economic problem. It's not just a nutrition problem. It's the whole thing. So how do you begin to understand shifting from a world that doesn't pay much attention very well to the brain, a brain negative economy, as my friend Harris Ayer, if he's around, would say, to a positive, brain positive economy and society? So you need to identify the systems that have to change, some of them the advocacy system, so that broadens out to all of these brain issues. Some of it is nutrition systems and food and quality of diet and the microbiome. So how do you relate what happens to the body to what happens to food and what stage of life? But there are a whole series of systems that have to change. So part of the challenge that we're undertaking this year, with as many of you who would like to partner with us as possible, is to identify the systems that have to change, and then the indicators within each of those systems that we can begin to measure progress on. And we'll have to have a continuing series of collaborations and convenings around this where no one alone tries to solve these things, but we try and solve them or address them together. And that's the role of what you were going to either call it the Brain House on the road or something else. But it will be a challenge of 2025 to identify the systems change we need, the indicators, and the convening process by which we get at this in a much more significant, holistic way that involves every sector and every individual. Challenge, but damn it, it's important. It's our brains. So thank you for this extraordinary panel, and thank you all for coming, and keep coming back.